Hi, I'm Jen Connolly, Acting Director of Public Health in Stockport. Just wanted to take a few minutes of your time to talk a little bit about social distancing and why 2 metres counts. It's a matter for science and a matter for policy. The science indicates that distance really does matter. COVID-19 is transmitted by droplets, and further the distance, the less likely those droplets are going to be transmitted to you. So there's been a number of studies done, particularly in relation to the SARS outbreak in the Middle East. And they looked at increments of with even a change in 5 centimetre increments and the impact that made. So it does indicate that the difference between 1 metre and 2 metre reduces the risk by up to somewhere in the region of 30%. Varying studies give varying answers, as you can imagine. But 1 metre is sort of minimum adopted by some countries, but an extra half a metre and another half a metre to 2 metres really does make a further difference in the risk of transmitting that disease. Also, 2 metres is really important at the moment when we think about the contact tracing, the NHS Test and Trace programme. So as we release some of those measures of lockdown, the biggest thing that we can all be doing is ensuring we are isolating at home if we're unwell with any of the symptoms of coronavirus. And those are a fever, a temperature, a new persistent cough, or the loss of smell and taste. And it can be any one of those 3 symptoms. It doesn't have to be all of them. And it can be any version of those symptoms. They can be mild. It doesn't have to be a serious new cough so it's just thinking about all of those factors. It's really important that if you do develop any of those symptoms, that you isolate at home. That's for a minimum of 7 days. Your household should also isolate for 14 days. And at the point that you become unwell, you should immediately isolate and book a test. You can book a test on nhs.uk/coronavirus. You can book a test by emailing testing@stockport.gov.uk, or you can book a test by ringing 119, and a test you'll have that arranged for you. We know that we now know that most people are most infectious probably a couple of days before becoming unwell, up to but not exceeding 7 days after becoming unwell. That's why you need to isolate for 7 days. And to cover the period before you noticed you were becoming unwell, you will be contacted if your test is positive. You'll be contacted by NHS Test and Trace. They'll ask you where you've been and who you've been in close contact with over the past couple of days. And that, at the moment, that close contact definition includes anybody that you've been face to face with within a metre for 1 minute or more, or anybody who you've been within 2 metres of for 15 minutes or more. So with that in mind, you can see why 2 metres is really important, and keeping your distance of 2 metres from others when you're out and about, when you're at work, whether you're in somebody's garden, all of those things. Keep that 2 metres up, and then you don't become a contact. So those contacts who've been in close proximity with somebody who has become a confirmed case of COVID-19, those individuals will be asked to isolate for 14 days as well. No matter if they've got symptoms, no matter if they're feeling fine, you're asked to isolate because we're trying to break the chain of transmission. And in having been a contact of somebody with COVID-19, you may be incubating. And so we ask you to isolate for 14 days to see through that possible period of whilst you might be incubating and before you might develop symptoms yourself. So if once you've completed that 14 days and you haven't developed any symptoms, free to go about your business again. But again, remembering that 2 metre distance, it's isolating if you're unwell, and keeping your 2 metre distance are some of the biggest things that we can do to keep reducing the rate of transmission. The final thing is hand washing. Again, we need to get back to that point that we were all at the end of March with red raw hands from lots and lots of hand washing. Regularly, thoroughly, 20 seconds. You're washing the main parts of your hands, you're washing the backs of your hands, you're washing your thumbs, and you're washing your fingertips and right down to your wrists. So really good, thorough, regular hand washing. Really important that we adhere to that, those asks to isolate. So even if you're contacted and you're feeling absolutely fine in yourself, really important to isolate for 14 days once you're advised to do so. And it's important that as employers, colleagues and as friends, we all support each other to do so.